Basically, I'm fine. I can't sleep very well, and I need some sleeping pills to help me sleep. So I just really
Mm.
wanted you to write a prescription for me, and I'll be out your way.
Yeah, I hear that. I hear that you're wanting some sleeping tablet, but could you tell me a bit more about your sleep to help me understand better?
Well, I'm just finding it hard to sleep, so I just need some tablets, please. Yeah, if you could just do that for me, that'd be great.
Yeah, okay, Patrick. I can see that you've had problem with your sleep 2 years ago as well.
Yeah, that's right. Yeah.
Yeah, in order to be able to help you better, it may be important that I understand what's going on with you.
Well, I'm just getting tired. I find it hard to drop off, and I wake
Mm-hmm.
up early. And I had
Mm-hmm.
some. What did I have last time? I've just written it down here. Temazepam. Is that right? Yeah, they work
Yeah.
really well. So if you could just write out a script for those, yeah,
Mm-hmm.
that's it. That's all I need. Thank you.
Yeah, Patrick, I see temazepam can be given to some people who are having problem with their sleep.
Yeah.
Um, yeah, but it's important, I mean, how has that affected you? I mean, the sleep, how
Well,
has it affected
it's
your day to day?
it's not great.
Mm-hmm.
It's hard to concentrate at work sometimes, and
Yeah.
I struggle. I struggle to drop off, and
Mm-hmm.
I get a bit ratty with my wife, obviously, because
Mm-hmm.
I'm not in a good mood.
Mm-hmm.
Um, I'm working hard, working long hours. Yeah, it's
Mm-hmm.
tough. So yeah, some tablets
Yeah.
that would be
Yeah.
great. Yeah.
Yeah, I hear how difficult this is, and we'll do our best today to, help you out. And I hear how it's affecting you at work, and it seems to be affecting you at home as well. You know, to start with work, what do you do for work?
Oh, I'm a long distance lorry driver.
Yeah, okay. And have you found yourself sleeping off while on the steering?
Dropping off while I'm driving, did you say?
Yeah, yeah.
Oh God, no, 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 no. No, it doesn't affect my driving. Good grief, no, no. I drink quite a lot of those energy drinks when I'm driving. You know, the
Oh,
caffeine stuff, and
yeah.
that works really well. In fact, all the drivers use it, especially on the night shifts. And
Hmm.
a couple of drinks when I get home, early shift to get to bed helps me sleep sometimes. But yeah,
Yeah, okay. Um, you also mentioned your wife, and this is
yes.
beginning to affect you and your wife, with the way your mood. Is it affecting your relationship in any other ways?
Not a great deal. No, I'm just sometimes I get a bit ratty because I'm tired. That's all. Not
Yeah,
nothing. You know.
yeah, yeah. Does your wife complain about snoring?
No, no, don't snore. Never, don't think so. She's never mentioned it. No.
Yeah, yeah. I mean, I have my own thoughts as to what may be going on, but have you had any thoughts as to why it may be difficult for you to go to sleep?
I just think it's stress of money stress, money problems. It's
Mm,
I work long hours. I do a lot of shifts,
mm,
extra shifts, and my
mm,
brain's always buzzing, always going. So
yeah,
I don't want to waste anyone's time here, doctor. And I appreciate you're
yeah.
busy. I'm busy. So if we could just get the prescription written out, and then I can be on my way,
Yeah,
I'd appreciate that. Yeah.
yeah, yeah. We'll talk about that shortly, if you don't mind, Patrick. But in terms of these sleep problems, I get that the finances are contributing to it. Is there anything else you're worried about?
Uh, no, no,
No,
no.
no.
Just
Yeah,
not
and
sleeping well.
not sleeping well. Yeah, and
Yeah.
in terms of you wanting temazepam, is there anything else you were hoping that I could do today?
Well, I just use that because that's what I had found. It worked pretty well. But if there's another drug that works just as well, I don't really care what it's called, what it is.
Yeah, and a few things about our life that can affect our sleep. I mean, it says that you smoke 10 cigarettes a day. Is that still the case?
Yeah, sometimes less, never more than 10.
Yeah. And he also says that you drink about 3 pints a week. Is that still the case, Patrick?
I do, but I also have a drink at night sometimes to help me drop off to sleep. So I'm probably drinking
Mm,
a bit more than I should, if I'm honest.
okay. Right. And then just to talk about this sleep, you mentioned about just not being able to go to sleep. And
Yeah,
yeah, have you noticed waking up early?
yeah. Wake up early as well. Yeah.
Yeah.
So I'm not
And
getting a lot of hours sleep. That's the problem. So I thought
Yeah.
the tablet helped me, fall off and stay asleep.
Yeah. And do you feel refreshed after sleep?
Not particularly, no.
Yeah. Okay. And okay. Um how would you I know it says in your records that you had depression 9 years ago. How would you
Oh, it
describe
was a
your mood
long,
at the
long time
moment?
ago. I've got that was a previous relationship went sour and all sorts of shit happened. Excuse my language.
Mm,
And yeah, I'm fine now. That was a long time ago when I was much younger.
yeah. And the good thing is that your mood is okay now.
Yeah, my mood's fine. It's just tiredness.
Yeah.
I eat well. I do a bit of exercise. Maybe I'm a little bit
Hmm.
overweight. I don't know.
Yeah.
I don't get tired during the day. It's just late when I'm doing the late shifts. I come home. I want to go to sleep, and
Yeah.
it's hard to drop off. And then I don't. I wake up early, and that's
Yeah.
it really. So yeah,
Yeah.
I need some tablets
Yeah.
to help me sleep. That's simple, really, isn't
Yeah.
it?
So yeah, Patrick, I think what you have is what we call insomnia, which simply means lack of difficulty to sleep.
Correct.
Yeah. And I know that there are a lot of things that could be contributing to your lack of sleep at this point. Yeah, I know that you are wanting some temazepam. I mean, with regards to temazepam, there is a few things that we worry about, and it may be important. Is it okay if I talk to you through them now?
What about temazepam?
Yeah,
Yeah, I mean, I had them before. The last doctor, he was quite
yeah,
understanding, and I took them, and they helped for a while. I didn't take them like for a long, long time, a couple of weeks, or
mm,
what it was, 3 weeks. I can't remember. Yeah,
yeah,
but I
yeah.
wasn't hooked. I'm not a drug addict or anything. I don't crave them. If that's what you're saying.
Yeah, I know, but we're worried that it's with time, I know you're not a drug addict, and but what we worry about is that you could get addicted to it, and it could
Well, I
make
can't be
even
addicted to
sleeping
it, Doc.
even
Yeah,
worse.
yeah, but I can't be addicted to them because I haven't had them for ages. I'm just
Yeah,
looking for a
yeah, I know.
solution. I'm just looking for a solution to get me to help me to get to sleep. For the next,
Yeah,
now help me sleep. That's all. If you can come up with
yeah,
something else, that's fine. I don't care what it is.
yeah. Yeah, so yeah, we have other options of things that could help you with your sleep. I know that you are taking these caffeine, these energy drinks to
Yep,
help you with your sleep, and also alcohol.
yep.
However, they actually have been found to have the reverse effect even.
Yeah,
So
the energy drinks though they really do get me through the long shifts.
yeah,
I can't stop those. They I can't have hot coffee when I'm driving, obviously, so I can have a
yeah,
can of drink at the side of me, and that's allowed. Yeah.
yeah. So yeah, but because they have a lot of caffeine in them, they
Mm,
could also have an adverse effect on your sleep as well.
yeah.
I mean, is it something that you would think about, cutting the amount you're having because that could help with your sleep?
Well, I, I do rely on them to be honest with you to get me through the night shifts. I've got to be
Yeah,
honest with you.
yeah,
Nothing else seems to work. So all the guys use them. The
yeah,
monster drinks, those drinks things. And yeah, maybe it does have an effect on my sleep, but I have to work long shifts. I have to do night shifts. I have to earn the extra money, and there's no
mm,
other way around that. You
yeah.
understand that? Sure.
Yeah, I hear the finance is the problem, Patrick, but I mean, we have the social prescribers who can look into your finance situation and be able to suggest things that may help, and maybe probably you qualify for certain.
If you could suggest how with the mortgage rate going up, you'd be a magician. That'd be great.
Yeah, okay. And how about we can try maybe try some other medication rather than temazepam, for a short while.
What will that do? Will that help me sleep?
That would help you sleep, but I could only give you for say 4 days and see you again in after 4 days to see, what we could do.
Okay, yeah, 4 days gives me 4 days sleep. What are these drugs called? What do they do?
It's called zopiclone. It could make you a bit drowsy, so you take it, say for, before sleep.
Before I go to bed,
Yeah.
right?
It can make you feel sick. I mean, but this is just a short-term measure because it's in itself is not something that we encourage.
Yeah.
I mean, in the longer term, we could talk about what we call cognitive behavioral therapy for insomnia.
Right.
That's it's a kind of talking therapy where they help you with skills and strategies on how to, get to sleep earlier and
Oh,
all.
you mean like counting sheep or stuff like that?
Yeah, talking therapy. They are very good at what they do, really. A lot of my patients have found them really useful,
Okay.
and that may help us longer term.
Yeah.
Okay. Do you have any questions so far? I know I've bugged you so much.
Yeah, thank you. I appreciate your time. Obviously, time is money. Um, so we're going to start these other tablets in 4 days. Yeah, if I can
Yeah.
have those today, so I can get some sleep tonight because I'm on an early
Mhm.
shift. That would be great. No, I'll try and cut down on the drinks, but
Yeah.
it's not going to be easy. I'm going to be honest with you,
Yeah.
but I'll
Yeah.
see what I can do. Yeah.
Yeah. I mean, with the night shifts, if that's affecting you, do you think that talking to your manager may be able to make them to bring down your, make it,
No,
less?
it's not a question. No, I want the night
Yeah.
shifts because I
Yeah,
want
I
the extra
know.
money.
Yeah,
Yeah.
I see.
Yeah,
Yeah.
we've got a little in at home. My wife doesn't work anymore. It's just me. It's tough. It's really tough.
Yeah. I mean, we could talk about that a bit in next time if that's okay with you.
Okay, well, that was quite challenging.
Tough, tough.
And yeah, I don't think we have any solution for the mortgage rate going high. Um, let's hear it from the role player. How did Patrick feel then?
Um, I thought you battled on very well, considering he was quite fixed on just wanting to get tablets and get the hell out of your hell out, So I think you kept going, which was really good. How did I feel? I feel that I was feeling frustrated at the beginning that I just wanted you to say, yeah, I need to give you something straight away to help you sleep. So I think if you'd have gone with that first of all and then said, however, this is just a short-term fix and we need to look at the real reasons behind it right at the beginning of the consultation, I think that might have helped a little bit. You allowed me to go on and on just on sleeping tablets, on sleeping tablets, on sleeping tablets. I was repeating myself. And when you said there's a different tablet, as you can see, I didn't care what it was. I just happened to use the word temazepam because that's what I was given. I don't know what it is. It just helped me sleep. And when you said about the cognitive treatment you could supply or offer, I was very skeptical about that, if I'm honest with you, to start with. I didn't really get that at all. So maybe it needed to be explained exactly what that does and how that can really, really be helpful in the long term. That's what Patrick felt.
Thank you very much. That cognitive behavioral therapy, it sounds very technical, and speaking with somebody who may not have heard of this, they might be quite skeptical. So you want to make sure that your explanation is pitched at the right level. All right, don't use these technical words. And it's important here in this negotiation skill assessment where you're being assessed on how you negotiate on this sleeping tablet, that first you actually listen actively and listen very well so that the patient feels they are listened, and then find a common ground. This patient, they're coming to you. Yes, they're saying they want sleeping tablet, but they really want to sleep better, to have good sleep. That's what they want. They're not coming to you just because of the sleeping tablet. The sleeping tablet will help them to get good sleep. So that's a common ground here. So if you explain to the patient that I understand that you'd like to have a good sleep, restorative sleep right now, you don't feel that that's the case, the things that we could look into how you can get better sleep. And then by working from a common ground, it's going to be easier to explain to the patient, as in with sleeping tablets, although you might get off to sleep, you might feel groggy in the morning, and it's not really good quality sleep. However, I could give you a small dose for Zopiclone for 3 days and see how we can reset your sleep cycle to get you back to a good bedtime routine and sleep. And hopefully you'll be able to sleep better in the long term. The sleeping tablet is not a solution over the long term though, because there is risk to it. And see how I'm actually working from a common ground and explaining what we're going to do. Then you can address the caffeinated drinks, because you're working from the same place and the patient doesn't feel like it's adversarial, you against the patient, but it's more like you're on the same side, achieving the goal of getting better sleep. So they'll be then more open for the caffeinated products, as in this could affect their sleep, maybe to try and take it early in the morning rather than late at night. So that would be how you could work it, the negotiation here. Does that make sense?
Yeah, it does. Thank you.
If you found this video useful, then I'm sure you're going to get a lot from watching this video. Click the video to watch it. Take care, everybody. Bye-bye.